I want to talk a little bit about healthcare delivery systems. First, let me say that I know when we talk about a word like a healthcare delivery system, it's a bit of a wonky term. Most Americans' eyes probably glaze over when experts, politicians, or pundits describe the problems with our healthcare delivery system. They don't know what it has to do with their healthcare experience, their doctors, or their lives. But the reality is healthcare delivery systems have everything to do with all of that. These delivery systems determine how Americans receive their care. They dictate how a doctor treats their patients, how long a patient must wait for treatment, how much a hospital charges for its services, and how the medical community is held accountable for its mistakes. As we continue working to reform healthcare, we must take an honest look at our current healthcare delivery system and ask ourselves some basic questions. Questions like, do the systems we currently use to deliver healthcare work? Are we as patients, businesses, and governments getting the best value for our healthcare dollar? Do these systems encourage efficient, coordinated care? If you ask the experts on this subject, the answer you'll likely get is a loud and resounding no. The way I look at the role of healthcare delivery systems is the same way I look at building a house. To build a strong, solid, safe house, you have to start with a strong, solid, safe foundation. Our healthcare delivery systems are the foundation for all of our efforts in healthcare. If that foundation is off-center or cracked or built on uneven ground, it doesn't even matter how straight the walls are or how efficient the electrical system is. Nothing is going to work right. Right now, the vast majority of healthcare in America rests on shaky foundations. It's our job to rebuild these foundations before more Americans slip through the cracks. The good news is that across the country, communities are achieving success with innovative healthcare delivery programs. We should look at these models as we continue our work here in Washington. There's one example I'd like to highlight today. That example comes from my home state of New Mexico, from a county that makes up the boot heel of the southwestern corner. Hidalgo County is one of the most rural counties in our state with a population of just 5,000 people. Hidalgo County faces the same healthcare delivery problems as other rural areas. There aren't enough doctors. Patients must travel long distances for care, and as a result, there are higher rates of chronic diseases and health problems that require specialized treatment. To meet these challenges, the Hidalgo County medical community had to think outside the box. What they came up with is the Hidalgo Health Commons. It uses 4 guiding principles in its approach to health care. First, they acknowledge that in rural areas, chronic health conditions are worsened by limited access to health providers and are often compounded by poverty. Second, to respond to this challenge, they established a one-stop shop for medical and social services. At the clinic, you can find doctors, nurses, and dentists. Seek mental health treatment, fill a prescription, get Medicaid or Medicare, or apply for public assistance like WIC. Third, they work with the community to identify local health priorities and then align their services accordingly. And finally, they are a source of local economic and social development by creating jobs, serving schools, and offering family support. The Health Commons model has worked so well that it's grown to serve 5 sites across New Mexico, and they're not stopping there. The new Hidalgo initiative, which is still in development, will expand on the success of the Health Commons. The goal is to enroll all 5,000 residents of Hidalgo County into the health services program. Hidalgo County is just one example of the innovative work going on across the country. And it serves as a lesson to all of us that faulty foundations don't fix themselves. They require hard work and ingenuity and significant investment. If we're going to fully transform our nation's ailing healthcare system, we must first focus on the foundation, we must first reform our healthcare delivery systems.